The first public inquiry into mental health-related deaths in England will begin hearing evidence today. Over the next 3 weeks, the Lampard Inquiry will look at whether systemic issues contributed to the deaths of thousands of adults and children in mental health units in Essex. Our health correspondent Sophie Hutchinson explains.
Bereaved families of those who died while under the care of NHS mental health services in Essex, seen here staging a protest in September. This morning they're expected in London to do the same as the inquiry begins hearing evidence. Melanie Leahy's son Matthew was one of them. He said he'd been raped days before he was found dead in his hospital room. She told us what she wants to happen now.
The truth as to understand what's gone wrong, and ultimately to see real change in how mental health patients are cared for, or not just mental health, but people that use the mental health system, shall I say. Accountability, to understand what systemic failure has led to so many deaths. You know, initially for me, this has been a fight to understand what happened to my son. But, you know, we're 2,000 plus deaths, and every single one of those counts in my heart.
Baroness Lampard, the inquiry's chair, will oversee 3 weeks of hearings here in London in the first evidence sessions. The inquiry will examine whether systemic issues contributed to what are believed to be the deaths of at least 2,000 adults and children treated in Essex mental health units over a 24-year period from the year 2000. The inquiry will hear evidence from regulators, clinical staff and the chief executive of one of the NHS Essex trusts involved. The charity Inquest, which has supported many of these families, has said there must be an absolute commitment to duty of candour, with full disclosure of all the facts, and that the bereaved relatives deserve nothing less. Sophie Hutchinson, BBC News.